The ultimate final destination of uncontrolled diabetes and high blood pressure chronic kidney disease, and dialysis or transplant becomes the only way to survive. You have diabetes or high blood pressure, then you say, "I feel fine, I don't feel anything anyway." But while you're busy living your life, those two diseases may already be quietly damaging your kidneys. Think of your kidneys like very fine filters. Their job is to clean your blood every single day, removing waste, balancing fluid, and keeping your body in order. You have two of them, each packed with roughly 1,000,000 tiny filtering units called nephrons. Together they filter about 50 gallons of blood every single day, and most people never think about them until something goes wrong. When you have diabetes, your blood becomes like sweet syrup, thick and sticky. Imagine pouring syrup through a delicate filter every day after day, year after year. What happens? The filter slowly gets clogged and damaged. The tiny blood vessels inside your kidneys weren't built to handle that kind of sugar load, and over time, the sugar itself starts to scar the very structures meant to protect you. When you have high blood pressure, it's like blasting those filters with extreme pressure non-stop every hour of every day. The force of the blood flow slowly tears the sensitive filters inside your kidneys, and here's what makes it worse. High blood pressure and kidney damage feed each other. Damaged kidneys struggle to regulate fluid and sodium, which raises blood pressure further, which damages the kidneys even more. It becomes a cycle that quietly accelerates unless something interrupts it. This isn't a rare combination either. The two conditions travel together far more often than people realize, and when they do, the damage to the kidneys tends to move faster than either condition would cause on its own. That's part of why doctors treat diabetes and blood pressure control as inseparable when it comes to protecting kidney function, not two separate problems to manage on two separate timelines. Once the kidneys become damaged, problems begin. Protein that should stay inside your body leaks into the urine. This can make your urine look foamy. Waste and excess water that should be removed start building up, causing swelling in the feet, face, and body. You might also notice fatigue that doesn't go away with sleep, changes in how often you urinate, or a persistent metallic taste that makes food less appealing. None of these feel dramatic at first. That's exactly the danger. The sad part is, when symptoms finally appear, it's often already advanced, sometimes stage 4 or stage 5 chronic kidney disease. Kidneys are remarkably good at compensating for damage, which sounds like a good thing, but it means you can lose 60, 70, even 80% of your kidney function before you feel anything is truly wrong. By the time fatigue, swelling, or foamy urine become impossible to ignore, the filtering capacity that's already been lost usually can't be brought back. At that late stage, the options narrow fast. Dialysis takes over the job your kidneys can no longer do, filtering your blood mechanically several times a week, hours at a time, for the rest of your life, unless a transplant becomes possible. A transplant itself isn't a simple fix either. It means a lifetime of anti-rejection medication and monitoring. Neither path is something anyone wants to reach, and both are largely preventable if the damage is caught decades earlier. And please don't say this, "I'm stopping my maintenance medicine because it might damage my kidneys." It's not your prescribed maintenance medicine that damages the kidneys. What truly damages them is uncontrolled blood sugar and high blood pressure, left unchecked day after day for years. Some people hear a rumor online or from a well-meaning relative and quietly stop taking their medication out of fear, thinking they're protecting themselves. In reality, they're removing the one thing standing between them and faster kidney decline. Your medication is part of your protection, not the threat. So don't wait until dialysis or kidney transplant becomes your only option. Get your creatinine and kidney function checked regularly. Ideally at least once a year if you have diabetes or high blood pressure, more often if a doctor recommends it. A simple blood test can catch early warning signs long before symptoms ever show up, and catching kidney disease early gives you a real chance to slow it down or even stop it in its tracks. Natural habits may support kidney health, staying hydrated, eating less processed sodium, moving your body regularly, avoiding excessive use of over-the-counter painkillers that stress the kidneys. But let's be honest about what actually moves the needle. The most powerful protection is controlling diabetes and high blood pressure early, consistently, and without skipping the medications that are quietly doing the hard work of protecting your filters every single day. Your kidneys don't complain loudly. They don't send warning signals until the damage is already significant. That silence is exactly why so many people find out too late. Don't let quiet damage turn into a diagnosis you never saw coming. This is the kind of life-preserving truth that's easy to ignore until it's personal. Like this video and subscribe so it reaches you and the people you love in time.